Hi everyone, welcome to my channel. I'm Nurse ID. Please do not forget to subscribe and like for more updates. My very first post was on stroke, and this is the second one. Please subscribe to my channel. So I want to talk about Herpes-zoster today. You know, there are a lot of misconceptions about Herpes-zoster being caused by evil spirit or someone being responsible for keeping it for someone to come and sit and contract and all that. So it's not true. It is actually a viral infection. So at the end of my show, my presentation today, I think we will have a clue of what it is all about. So what is Herpes-zoster? It's also known as shingles, a viral infection caused by the varicella-zoster virus, the same virus that causes chickenpox. As you can see from this diagram, it mostly occurs on one side of the face or one side of the body, like this. This one is the one on the face. As you can see, these blisters, they're very painful. So those who have had chickenpox has this virus in them in an inactive form. So when they come in contact with it again, they can develop shingles. So meaning someone that had chickenpox before will later have Herpes-zoster when in contact with the virus. So if someone have not had chickenpox before and you come in contact with a person that has Herpes-zoster, you will not develop Herpes-zoster. What will be developed will be chickenpox. So these are the signs and symptoms: painful rash or blister on one side of the face or the body, often in a line or band, as I earlier showed in the first diagram. You can always go back to check. Burning sensation, fever, headache, fatigue, itching, photophobia or sensitivity to light, numbness and tingling, chills, and stomach upset. It is being transmitted through direct contact with the fluid from the blister of a person with active shingles. It takes 1 to 5 days for rash to appear after infection. So it means someone can be infected like today, you may not see the rash. You'll just maybe be feeling sick 4 days, then on the 5th day the rash will appear. So what are the risk factors for Herpes-zoster? Anyone who recovers from chickenpox is at risk for Herpes-zoster. The risk increases with age, from research that half of the people who have Herpes-zoster are age 60 and above. And why it's like that is because older people have weaker immunity. Those with medical conditions that weakens the immunity, like HIV or cancer, they are also at risk for Herpes-zoster. Those receiving immunosuppressive drugs are also at risk. For instance, someone that is on prednisolone or other steroids for a long time can also get it. And these cancerous drugs too are immunosuppressive. So that was why I said that one of the disease condition is cancer, and those cancer patients are always on immunosuppressive drugs too, which will also, the side effect of it is that it suppresses the bone marrow, which is responsible for immunity. So in that case, it's still a problem. So the treatment for herpes zoster is antiviral drugs, which helps to reduce the severity of the illness. Medications to be effective should be commenced as soon as possible after the rash appears. So the person may be sick and you don't know, but as soon as the rash appears and you see that it is typically the rash of herpes zoster, which is blisters with pores and with that pattern of burn and so forth, once it is confirmed that is herpes zoster, is good to start antiviral drugs to reduce the severity. Pain medications are also very important because it is very painful. Wet compress to relieve pain and burning sensations. Calamine lotion, colloid oatmeal bath also to relieve itching. So how is this virus being spread? Keep the rash covered. Avoid touching or scratching the rash. Wash hands frequently with soap and water, preferably running water. Avoid contact with pregnant women who have never had chickenpox or vaccine. So, seeing pregnant women, you may not know the one that had chickenpox or not. Some people used to have it maybe when they were very young and they can't remember. So the best way is just to avoid people with low immunity, like the pregnant women, the premature babies, the sick people generally have weak immunity. You avoid them, avoid crowd, and so on. So for NCLEX, please listen to the following questions. Question 1: which of the following disease conditions can be caused by varicella-zoster? Select all that apply. So the answer here is chickenpox and herpes zoster, because this virus is responsible for the two disease condition. One, which is HIV, is not related. That one is caused by human immunovirus. Number 3 is caused by Vibrio cholerae, so they are not related. Remember, I said in the first slide, you can go back to confirm that varicella-zoster virus causes chickenpox and shingles. Question 2: if an individual who has not had chickenpox before comes in contact with a person with herpes zoster, which of the following disease condition will the person likely develop? The answer is chickenpox. Yes, if you've not had chickenpox, you meet someone with herpes zoster, you will not develop herpes zoster. You are likely to develop chickenpox. Then maybe in subsequent infection, that's when the person will develop herpes zoster. As you can see, 2 and 4 is not related. The last question: on reviewing a patient with herpes zoster in the outpatient department, which of the following advice is best to prevent the spread of this disease? Isolate in a negative pressure room. No, that's for airborne. That's for infection that can be transmitted through air. Then administer prescribed analgesic. That's for pain. Have blisters covered when outside. Yes, that's the only related answer. Then number 4, should use masks when outside. Using of masks is for airborne infection, not varicella. Okay, so the answer here is 3. Have blisters covered when outside, because the major form in which an individual can contract shingles is through body contact with fluid of an infected person. So if the blister is covered when someone is outside, it reduces the risk of transmitting the infection. So please follow. Thank you very much for your attention. Follow my channel for more updates. Subscribe so that anytime I upload a new video, you can be notified. Thank you very much. Subscribe, like, and share.